surgery is the treatment of choice. In our hospital, in pandemic, because of the pandemic, we are doing routinely surgery. Because of pandemic, we also done surgeries, especially those patients they came and struck in the Maldives, and those our patients also. We took all the measures to prevent the spread of the COVID. We even first COVID we couldn't able to do anything. Second, after as Dr. Anil mentioned, some of the patients are recovered. Some of the patients they came as without any COVID infections. We took all the precautions. Like we have a dedicated team. This all goes to our team.
We would like to open the floor for questions. If anybody wants to ask something.
We, myself and Dr. Narendra are there in this hospital from 2009. We have done about 640 transplants. In them, 480 transplants are living donor kidney transplantations, and the remaining ones are deceased donor transplants. In these living donor transplants, we have done around 30 ABO incompatible transplants, which is the highest number in Karnataka actually. And also we have done around 4 paired kidney transplants or swab transplantations. And also we have done around 12 pediatric kidney transplants. All this will come to the living donor kidney transplants. How to halt or slow the progression of CKD. CKD progresses over stages. Stage 1 to stage 5 actually. Stage 1 is more than 90% of kidneys are functioning. Stage 5 is less than 15% of the kidneys are functioning. So to slow the progression, there are several issues we have to consider. One is the diet, physical activity. So we need to see that they have a salt restricted diet and also restrict their protein. Sometimes we may have to restrict the fluids as well. And if they are diabetics, their blood sugar control should be very good, and their HbA1c should be less than 6.5%. Blood pressure should be less than 130/80, and there are some medicines which will slow the progression, like a group of medicines called as AC inhibitors and angiotensin receptor blockers. So in addition, a regular follow-up with their doctors, and also if they are smokers or if they have a habit of taking daily alcohol, we should restrict. We should stop smoking, and a regular follow-up with their doctor is more often, and should avoid taking over-the-counter medications like some painkillers or some antibiotics which are harmful to the kidneys. So by doing all these things, we can significantly slow down this disease. But we should be aware that this disease is definitely going to progress, and one or other day they will reach end-stage renal disease.
So do you have a prescription for healthy kidneys?
I would tell all my patients that you take care of 8 points. So one is if you are a diabetic or if you are a hypertensive, so you see that your blood sugars are well controlled, your blood pressure is well controlled, so you take less salt, exercise daily, so stop smoking, and also if you are drink at least 8 glasses of water per day. So all these things are very, very important.
I am Dr. Naveen, working in the Department of Urology under Dr. Narendra sir. I have been witnessing the transplant which is happening from the past 2 years. In the mean gap, we have done almost more than 100 transplants. The main thing is about the team coordination, which helped us a lot onto the patient side also. So both the pre-op and post-op care will be taken very well, and the patients are also very much compliant, happy about the results what we have given, both pre-operative checkup and including post-operative follow-up also. The results are excellent, and the patients and both the donor and the recipient, they are totally happy, and I could able to see the smile of the recipient, which he was leading the normal life even after the transplantation. Thank you.
There were days when we started the transplant 2 years back after COVID by getting our own test done before transplant, which actually didn't work out to begin with. And after a few months, we came out with a biobubble system where we doctors used to be in a biobubble, the nursing staff used to be in a biobubble. We used to keep the patient relatives in a biobubble and come over it. Slowly we have come over that circumstance also, and currently it was a very challenging where we have done more than 72 transplants in the last 2 years I mean, and out of which 22 patients were even post-COVID patients, and they have recovered well. All of them have done well, and this is a very proud moment to share that we have managed the intraoperative events and the post-operative events and post-operative care very well for all our transplant recipients.